Hello, my name is Lilana Fradi. Today I would like to talk to you about intrinsic motivation in medication adherence. This is a topic that I studied during my PhD at the Università della Svizzera Italiana in Lugano, Switzerland. The objectives of today's talk are twofold. First, we are going to explore the role of intrinsic motivation and the importance of personalized goal setting in the context of medication adherence. Second, I am going to provide practical recommendations to pharmacists to increase medication adherence by increasing intrinsic motivation to adhere to the medication regimen in patients. Let's start by looking briefly at the intrinsic motivation on the self-determination continuum. A crucial aspect when we talk about motivation in medication adherence is distinguishing extrinsic and intrinsic motivation. The self-determination theory provides a framework for this, categorizing motivation based on its source and degree of internalization. In simple terms, extrinsic motivation is doing an activity for a separable external consequence or reward. For example, complying with the doctor's instructions only because there is a relative, a family member monitoring the medication taking habits. While in today's talk, we are going to focus on intrinsic motivation, which is defined as doing an activity for its inherent satisfaction or the internal belief that this is the right thing to do. This type of motivation is characterized by a high level of autonomy and the person acting based on their internal conviction and beliefs. They are not influenced by external pressure or reward. Individuals who are intrinsically motivated are more likely to maintain health behaviors, for example, adhering to medication regimen, because they really believe that this is the right thing to do, that this is the most beneficial choice for maintaining their health. To increase intrinsic motivation, healthcare professionals can guide patients towards self-discovery, helping them rely less on external stimuli and consequences and instead focus on their thoughts, feelings, and behaviors. Let's break down this big concept into smaller actions, starting with personalized goal setting. As mentioned before, intrinsic motivation strongly predicts medication adherence. A collaborative approach is key. Healthcare providers should facilitate patient empowerment, but also point out the importance of relying on the medical expertise of the healthcare providers to improve medication adherence. This entails involving the patients in setting realistic and achievable goals together. Let's look into SMART goals for this. A SMART goal is ensuring that a goal is specific, measurable, achievable, relevant, and time-bound. For example, a SMART goal that the pharmacist and the patient could set together would be, for example, setting a goal to simplify the patient's medication regime. Hence, it is a specific goal. Then the pharmacist and the patient would track the number of adherent days, measurable, attainable, since the pharmacist and the patient would work together to adjust the regimen for better adherence, relevant, aligned with improving patient outcomes by reducing complexity, and time-bound, evaluating the progress over 1 month, 2 months, or 3 months. As with any goal in life, regular review is advisable by periodically assessing and adjusting goals based on the progress and changing circumstances. When we talk about intrinsic motivation for medication adherence, we cannot not mention medication beliefs. First of all, a key for the patients in the medical setting is the perception of being listened to. Patients should be allowed to express their concerns and being asked questions. Building trust may require time and multiple conversations between the pharmacist and the patient, but this actually is crucial to elicit the patient's views and beliefs. Discussing benefits versus potential harm might elicit patients' medication beliefs and allow pharmacists to help them understand the potential side effects better. If a patient genuinely believes that the benefits of following the medication regime outweighs the harm, harmful being the potential side effects, they have a much higher tendency to comply with their medication regimen. Motivational interviewing can be a very helpful technique when the pharmacist engage the patient, establish an interpersonal relationship, focus, which involves collaboration to identify goals, evoke, which is related to the exploration of the patient's motivations for change, and finally plan together to develop action. For this, a collaborative style is crucial, like asking open-ended questions. For example, what are the challenges in complying with your medication regimen? A tailored approach is key since no one size fits all. Information should be always tailored to the individual patient's characteristics. For example, health literacy. A patient who is knowledgeable about their condition and about their medication requires very different information compared to a patient who is less knowledgeable about these. Empowerment and patient motivation to follow the doctor's advice about how to take their medication should also be explored. And also the disease type is very important since it also influences the emotional state of the patient. A patient who is calm is much more capable of understanding information, whereas an anxious patient might not be able to process those informations provided by the pharmacist. To sum it up, fostering intrinsic motivation and involving patients in setting personalized goals are essential strategies for improving adherence. And by empowering patients to take an active role in their healthcare decisions and goal setting process, healthcare providers can foster a sense of ownership and commitment, leading to more successful outcomes in medication adherence. Let's try to always remember to set SMART goals and explore the medication beliefs of the patients. I hope that today's tips were helpful, and thank you very much for your attention.